Welcome to the Spark Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the fire implementation guides designed by the Spark community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals, and related resources, please visit sparked.csiro.au. Today, we're joined by Paul Main and Saif Ali from HealthLink. Paul is a digital health expert with 20 years' experience designing interoperable solutions across healthcare settings. He's HL7 and Fire certified with deep experience in referrals, prescribing, and discharge systems. Saif Ali drives e-referral product strategy across major projects in Australia and New Zealand. He has a strong background in digital service delivery in the New Zealand government. Thanks both for joining us and sharing your experience, and also a demo which we're excited to see.
Thanks, Michael.
Thanks, Michael. Happy to be here.
All right. First question. So, what are the current challenges of health information sharing in Australia? Maybe, Paul, I'll start with you.
Yeah, thanks, Michael. I guess one of the big things that I've noticed over the years working in health IT now is how document-based a lot of the exchanges are. So very much, within the acute care system where I sort of cut my teeth, it's very much about point in time. Here's a snapshot of, a discharge summary or a specialist letter or a pathology result. And it was very, very directed, very much, about sending to a specific recipient. Now, what that means is, by and large, it's very hard to then discover information. So if you're involved in the patient's care down the line and outside of that sort of hospital ecosystem in particular, it does become very hard to find the right information about the right patient at the right time to support your clinical decision making. So we really do, see the world changing and really want to be supportive of that. Saif, do you want to add to that?
Yeah, for sure. I'll bring it back home. So that was a good summary of the industry. So what I look after, the e-referral. So what I'm seeing is, for me, the key things are time to market, right? And making sure from a user point of view, our referrers, they've got this consistency in terms of experience and workflow. But one of the things about it is everything underpinning all of that are these bespoke integrations that take a lot of time. So without, I guess, standards, it makes it really hard to get something out there quickly. And as Paul mentioned as well, all of these interactions are point in time. So the workflow, there isn't much consideration for workflow. It is capturing what it is in a point of time and passing it on. So it's that for me has been the greatest challenge in this role in implementing referrals.
Definitely, it's the old world sort of view too of the handover of care rather than that shared care model too. So it's great to see that we're finally getting some technology that can actually better support those new workflows and that new way of sharing the care.
Yeah, absolutely. And that segues nicely into, I guess, what problem do you think that Spark solves?
Yeah, well, exactly. And that's where Spark has been sort of pivotal, I think, in Australia in pushing the industry forward, sort of showing us what is possible. And that's particularly around, moving away from the old HL7 document-based sort of approach I was talking about there to that more federated, discoverable, fire-based model. Underpinning that, obviously, you need those data standards. So as Saif was saying, you need to move away from those bespoke interfaces. You need to have a common understanding of the data models, of the semantics of that data, and commonality of code sets too, so that you can then very easily build a solution that can be applied across different systems with different vendors, in different jurisdictions as well, but with the same base technology. Lowers the investment for all of the vendors out there, for the government, for the health system at large, but then really supports the point in time clinical care for the patients, which is what's really important for us all.
Yeah, and adding on, for me, it's been like refreshing to have all the stakeholders involved, right? So it's a vetted process, there's trust within the standards, and implementing e-referrals, quite often the biggest challenge is getting everyone to agree. So, part of this process brings everyone together, and there is that vetting process for me that makes it really easy to connect through and implement.
And look, even from that specialist outpatient sort of lens there too, they're trying to get agreement between the different specialties within an organisation, let alone between organisations and jurisdictions, is hard. Having that solid foundation of a common data model to bring it all back to and say, this is the standard for good reasons. It has been thought through. It does, cover the use cases that we're trying to implement. And bringing it back to that makes it much easier to have a sensible conversation with clinicians and jurisdictions in particular.
Yeah, I think it's great to see, I guess, that we're that platform to enable those conversations to happen. And also, like you mentioned, it's lowering the cost of implementation and also increasing the value of being able to have that information flow more freely through the system for patients. Now, in terms of, I guess, HealthLink, why is HealthLink involved in Sparked?
Well, it's a good question, and one that we were asked very pointedly, I think, when we really first started getting involved. A lot of people, sort of look at HealthLink as just that secure messaging company, and in some respects, a little bit of, point-to-point messaging being part of the problem that I was describing there before, or not quite being the full solution, I guess, that we want to that information discoverability and sharing. We kind of see, though, that we're not just about the secure messaging, we are about the information exchange. Secure messaging is just a way to make that happen. Our referral platform, as Safe's been talking about there too, is very much around that newer way of actually sharing information. It's not HL7 based. It's primarily been deep integrations with the practice management systems to get that atomic information into the clinical systems within acute care. So we see ourselves actually as being able to help bridge the gap, I guess, between those old ways of working, so the old HL7 point-to-point, and the new ways of working with FHIR-based distributed, federated sort of models as well. So that's why we're involved in Sparked, and we see Sparked as a great way of actually helping us to help the industry, particularly around things like e-referrals. We are in basically every state and territory of Australia except Queensland for doing statewide e-referrals. So we are very keen to push forward on a standardised sort of approach across the country, and obviously take those learnings over to New Zealand as well.
Yeah, and I think it's a good, I guess, example of lifting the industry as a whole. It's not about any one company in particular. It's about lifting the benchmark of what's possible in terms of that information flow.
Yeah.
So, you were going to add?
Yeah, Paul pretty much covered it, but also I guess having done these implementations, there's lots of lessons learned. Obviously, we don't want to be hung over on that as well, but there's good stories and good actual practical problems that we can bring to the table. And as Paul said, it's working with the community and the vendor partners in the sector, helping us push things along as well, right? It's working collectively together.
Definitely. I love that I can go to these sessions, connect with Andy and Angus and talk about, why they chose to solve some of the problems or model the data the way they did for their e-requesting solutions at the moment, working with those guys to look at the use cases we're talking about, see how, what other options we have or how we can take that existing model that they've done, extend it, adjust it as necessary for these broader use cases. So it's very energizing and very invigorating, I think, too, to be working with the community to solve these problems.
Absolutely. I think that energy of the community is really inspiring, isn't it? I think I'm really keen to hear about what Sparked FHIR implementation guides you're actually implementing. Could you maybe share a bit about what you've done there?
Definitely. So I guess we probably didn't explain this very well at the start, but what we've done with most of the newer state health department implementations of our e-referral solution is use a FHIR service request based approach. Now, it's it predates the work that's been happening through the e-requesting. We have, though, based that off the AU Core data models as well now. So we are using that as the basis of it. We are now working, though, to turn, the work that we've done, as Saif was mentioning there too, into, or take those learnings, turn them into our own e-referral, IG, off that e-requesting base. And bring that back through the community process to get that feedback to bring the community along as well and help push that forward. At the same time, we are now looking at how we could use the patient summaries to support the request for more information sort of flow within that referral process too. So where you do need more detailed clinical information to support the triage and the assessment of the patient through the referral processes. The AU patient summary looks like a really good candidate to help us with that. And then we're also, we have been, and we'll show this in the demo, been working with our Smart on Fire launch, our Smart on Fire application, I should say, so that we can actually launch into our smart forms, our existing smart forms via, a Fire interface to populate it, so via that standard data model. And through that, we've been able to work with CSIRO and make use of their Fire questionnaire renderer as well to really supercharge that forms capability platform. So a few different things going on there, I guess. Michael?
Yeah, sounds good. This is great to hear all those buzzwords of in terms of Fire RGs. We've got AU Core, we've got e-requesting, we've got patient summary. It's great. Well,
trying to work on all of them.
Yeah. Well, with that in mind, it'd be great to see them in action. I'd say, if I understand, you've got a demo for us.
Yep. So I'll showcase our Smart on Fire launch from Helix Cloud Practice Management System, Telstra's.
Great.
Let me just share my screen. And
Take it
Paul, you
away.
can jump in at any moment as well. So I'm jumping into within a patient context, obviously a test environment, so no issues with data privacy. So here we've already got, I guess, the site and the provider details in context. So we're launching into patient context, which is where HealthLink comes in. So the same pattern repeats across all the practice management systems that we integrate with. It's one click into the HealthLink realm where a e-referral is required. Paul, did you want to add in anything on that?
Yeah, I think this has been like one of the very early sort of Smart on Fire integrations that we've done. So it's been great working with the Telstra Health team and particularly with the Smile CDR back end that they've got there. And, through that process, we've had to be working with them on how to actually map the AU Core concepts and make sure that the underlying data model that they're using really fits in with that. So it's been very interesting, but very useful to have that AU Core base that we can all reference and make sure we are using a common data model.
Yep, and launches through to our homepage where we have our existing e-referrals, smart forms, we call it. And obviously for a site, this is because it's demo, there's a large number of it. You aren't bombarded with so many. We only display what's relevant depending on where the site is. For example, New South Wales, we only see content that's New South Wales specific. But on that, we're able to map through to our old legacy standards as well, so that with using the same platform, we're able to get through and launch and access the same services as well as the new Fire questionnaires as well. Right now, they're two separate links, but we're working to make sure that it's all available using the one homepage as well.
Yeah, and so just to reiterate the point a little bit there, Michael, what this means is that through that that underlying smart launch layer, we're able to expose and populate our existing forms. Now we have thousands of existing forms out there in our forms platform used across Australia and New Zealand. So by having that Smart on Fire launch and then mapping to what were previously bespoke APIs and bespoke concepts that we had to get the practice management systems to implement, we can now consolidate on that standard Smart on Fire launch and those Fire concepts to actually populate this, which is good for us, and it's good for the practice management systems too, so that they can double down on their Smart on Fire based approach for their ecosystems. I think the fire questionnaires there too safe. Like the really great thing about that is how easily we've been able to get the Cyro fire questionnaire renderer up and running and embedded in the platform so that we can actually roll out those new fire questionnaires and start to develop our own fire questionnaires to solve specific problems. And the sort of ones we're thinking about here are the National Head to Health sort of mental health services, or Medicare mental health services, I think.
Yeah. So this is an example. We slowed that down a little bit just to show what was happening. Again, touching base on you've got that patient context, and then the questionnaire launches as well, and then there's that pre-population there as well. So you saw that as that was loading through. That was sort of deliberately done to showcase that as well. So again, demonstration that we're able to launch our old sort of that more point-to-point services with new questionnaires as well that have more workflows driven from it, and then we can retrofit our old services with some of these capabilities as well.
Yeah,
with I guess as Paul mentioned, like with addendums previously, then that's filling out another forms. Now we can do that with, I guess, patient summaries as an example. So leveraging our existing framework, but just moving to a more natural organic workflow using FHIR standards.
Yeah, and that's a really good example there where that would be a very difficult use case to solve using an old HL7 sort of based messaging exchange in the back end there too, Michael, whereas FHIR is a much more natural fit for actually solving that problem.
That's pretty much it. I guess it doesn't look exciting, but it does solve a
Very
lot
exciting
of
for
problems.
us.
Yeah.
No, it's a great foundation to build upon, and I think that's I guess a really exciting, I guess, window into what's possible as we build out this stuff, because it's only just the beginning of where we are in terms of our standards journey. And obviously we need to sort of build out the adoption component of that and what that looks like. So it's really exciting to see where things are heading. So good work.
Definitely. I can say that, through Sparked, we know that all of our practice management specialist, allied health sort of vendor partners as well. So are, the vast majority, I should say, are heading down this path as well. So that's great. That's great for us. It's great for the industry, and it is going to make that these sort of integrations much easier, much more cost effective, and much more ubiquitous as well. And that's got to be good for the industry.
Yeah, absolutely. And with that in mind, I guess, why should others get involved in Sparked?
A good segue. Well, it is about actually being part of the solution, I guess, in a lot of ways. Like if you embrace the standards, if you embrace the community sort of process here, then there is really good opportunity to be able to invest. I was going to say once, but you invest in a consolidated way for that integration, and you can then take that to multiple different partners. You can build an ecosystem with your partners and work with the industry rather than trying to solve all of these problems in isolation and then have to maintain them in isolation as well. So bespoke interfaces, we all hope are a thing of the past, but that's what we're pushing towards. But the really nice thing is getting involved and helping to shape those standards so that they will work for you and work for the sort of use cases you're trying to solve.
And bringing your use cases to the table, right? And for me, the great benefit of this is quite often we have been in forums, but it's more technical, right? So this way, we've got clinicians in there feeding back into what's relevant, what works, what will be more painful to them. So it is bringing the two worlds kind of together as well, which has been really beneficial, and you probably don't see quite often.
Yeah, it's often very hard to get the clinicians to be thinking as deeply as they do at the Sparked events, particularly in those clinical design groups around the problems. And, also it's great to have the patient advocates at the table as well, so that we are making sure that, we really are considering how these new workflows, these new ways of exchanging information can include the patients, can bring them into that journey. And it's, they're not left outside of their own healthcare, which obviously is not good for anyone.
No, and I think we're really lucky to have such a diverse and representative attendance and participation from the community, and they continue to participate, which I think is fantastic. And in terms of, I guess, parting key message in terms of adopting fire standards, and what would you suggest in terms of adopting these national fire standards?
Well, I guess it is about finding those use cases that, fire helps to solve the problem. And typically, we are talking about integration. There are some really big advantages too, though, to using fire for some of the data storage as well. There's some really good emerging solutions out there to help with the reporting, the extraction of information from fire-based repositories. And it does then make your information available for others to share very, very easily. So it's important to be involved to help shape that. I guess from our point of view too, Michael, like we're committed to making sure that we have the right information available at the right time to support the clinical care. Sparked really does give the opportunity to work with industry, with your peers in industry, with the government as well, to make sure that you are actually solving or helping to solve those big systemic problems. So I think that's a good enough reason to get involved, but it does also then help you to support, the industry standard and provide a really nice pathway for that future healthcare model that we all want, I think, as healthcare, as health consumers ourselves. So it is good for the country.
Yeah, pretty much echo that as well. Plus, I guess it's not only, like, quite often, as Paul mentioned, it's solving everyone else's problems as well as yours. Quite often you would end up with tunnel vision when you're only dealing with what you have in the space that you have as well. So you're not able to see the wider picture and the wider things at play. So being connected at an industry forum kind of helps understand and sets context. Whereas I guess if you kind of look at your own problem, you kind of get isolated within that and think this is it, this is everything.
That's a much more concise way of saying what I was trying to get across there, Safe. That's it is very much around like helping to get that systemic sort of view of, where your pieces fit into and how you can actually help make the system as a whole better, which I think is actually really important. And it sort of goes to the relevance of what problems are you trying to solve as a vendor as well.
Absolutely. Well said. I think in terms of, I guess, just wanted to say a big thank you to your participation as a good corporate citizen. I think it's really fantastic to have your involvement in our events and at Connectathons, testing your product against the standard and vice versa. I think it's fantastic to see that level of engagement. The other thing that I just wanted to say is, I guess, a big thank you for your time for this session, in terms of investing your time and contributing, learning and providing education to others who are interested, and we couldn't do this without you. So, and for those watching at home, if you're interested in participating in Spark, there's a QR code that will take you directly through to registering. Also, if you want to know more about what we're doing, feel free to jump on our website and have a poke around. And we've also got a podcast. We've got season 1 is out at the moment for those who are interested, and we've also currently working on season 2. And we share a lot of information and updates on LinkedIn as well, so give us a follow. And then lastly, if you do have any questions, you can email us at sparked@csiro.au. Thanks, Paul and Safe, for your time. Really appreciate your chat.
Thanks,
Thank you,
Michael.
Michael, for
That was fun.
Cheers.